Do people who experience homelessness use emergency services at a higher rate? I know you've referred to that, but
Yeah, I would say, as we've been talking about, absolutely, if we think about LGBTQ2S people who are experiencing homelessness, and they may not have access to to primary health care, especially a place that they feel comfortable and safe, or like an affirming service. And so then, if you don't have access to a physician who understands your needs and is able to address your needs, then of course you're then you have nowhere to go for for healthcare. And so then I think that oftentimes things will start to build up, and people often end up in a situation where they reach sort of a more of a crisis point, actually, and they have no other choice but to access emergency medical services. And that's because they don't have that ongoing sort of support, or that ongoing primary health care where they can have have appointments whenever they need to. And so then people may end up just avoid, it comes to this point where it's like, I'm just going to avoid it, I'm not going to go. And I think that that really is sort of the narrative that I am used to hearing when I working with young people, is that yeah, you just end up avoiding it. It's like you end up avoiding a lot of spaces because you know how you're going to be treated, and you know what that's going to do to your mental health, or you don't want to put yourself through that. But then, as we've been talking about, like you just end up in this situation where things get really bad, and you have no other choice but to access emergency services. So I would say, to answer your question, yeah, I do think that people experience LGBTQ2S people experiencing homelessness do probably access emergency services at higher rates, and I would say that is the reason why. I'll just give you an example. I am leading a study right now where I am working with administrative health data, and so the study is not necessarily focused on homelessness, but the study is focused on identifying transgender individuals in Ontario using administrative health data. So we're working with OHIP data, for example, and we've identified over 2,000 trans people in Ontario, which is quite a large sample, especially you doing research in this type of way, because it's typically very difficult to identify trans people using administrative health data, because a lot of services don't actually ask patients how do you identify, so they don't record that information. They typically just go off of your OHIP, which class will just categorize you as male or female. So there's no way of knowing who's trans, who's non-binary. But we have found a way to work with specialty clinics who do ask and collect this type of data. And so we found that the rates of emergency services, we can look at like how often are those 2,000 folks actually accessing the emergency department, and how often are those emergency department visits due to mental health reasons or suicidality. And so we have found that the rates are actually alarmingly, that they're really quite high. And so, those people aren't necessarily experiencing homelessness, but we also know that there is a disproportionate rate of homelessness, among the population.